Welcome back. While U.S. President Donald Trump says his administration won't put the country into lockdown, Trump also expects the coronavirus vaccine to be widely available for the entire population as soon as April. The United States accounts for over 10 million COVID-19 cases and over 244,000 deaths. So joining me now is U.S. correspondent Simon Marks on this. Simon, thanks a lot for joining us this evening. I mean, to know the fact that the United States is sitting with the coronavirus as the third leading cause of death in the United States, and yet U.S. President Donald Trump is saying that there is no ways that his administration is putting the country on lockdown. Has there been a contingency plan in place or a solid plan in place enough to actually mitigate against this growing number of infections?
Yeah, I mean, the only contingency plan, Faith, is there's a change of government here on January the 20th, and the country has to weather the 65-odd days between now and then, because Donald Trump made it absolutely apparent in that press conference in the White House Rose Garden yesterday, where he didn't acknowledge defeat in the presidential elections and continued to speak as though he's still going to be running the country for the next 4 years, that between now and January the 20th, he has no intention whatsoever of implementing a national policy with regard to COVID-19. There were 177,000 new cases of infection yesterday alone across the United States, a new daily record. Hospitalizations climbing, deaths climbing. In South Dakota, the governor has told healthcare workers they now have to stay at work even if they test positive for COVID-19. Mobile mortuaries have been brought in to parts of Texas, but the president's message was entirely focused on the vaccine and vaccine distribution. That, he says, is the key to bringing the incidence of COVID-19 down, but he conceded he won't be getting vaccines into the hands of most Americans until next April at the earliest, and if we're all honest, he won't be doing it at all, because by then Joe Biden's going to be in the White House.
Well, as you say, he's showing no signs of actually relinquishing himself, removing himself from the White House in that regard. But is it true that also cities have been left to their own vices in terms of finding plans?
Yes, absolutely. I mean, they have to do that, of course, in the absence of national policy. And look, Joe Biden talks in terms of coming into office and mandating the use of face masks nationally all over the country. It's far from clear he's going to have the power to do that constitutionally. His own legal advisers have conceded they don't know that he would have that authority as president. And as we've seen over the last year, you know, one of the great weaknesses of the battle against COVID-19 here is that it's 50 separate battles in 50 separate states and cities themselves, places like New York, where the mayor is now warning he may be about to close the schools down again. They've only been reopened for about 4 weeks. It falls to these individual local leaders of wildly differing capacities and political viewpoints to determine how to battle COVID-19 and ultimately how to distribute the vaccine. So Joe Biden is talking about a national plan, but just how much of that he actually gets to implement once he takes the oath of office next January is going to be the big question here, as is the question of how many deaths this country will have recorded by the time Joe Biden gets to put his hand on that Bible and swear the presidential oath.
Well, let's talk a little bit about this vaccine. I mean, have any details been provided in terms of how it will be disseminated to the American public? I mean, we do understand that it's expected to take place in April, but we are a long way from April, especially in the midst of a pandemic. You and I would agree on that, Simon. And we do not want to know the fact that deaths would have been just amounting to, you know, absolutely incomprehensible amounts just until then. So any details provided on the vaccine in itself?
Yeah, so the president said yesterday that the vaccine will be distributed initially to frontline workers, the elderly and those with pre-existing vulnerabilities to COVID-19, and that, he said, would begin within a matter of weeks. Now, there seems to be some dispute between the vaccine manufacturer Pfizer and the Trump administration. The Trump administration insists that this vaccine was all created as a result of President Trump's Operation Warp warp speed project. But Pfizer says that's not the case. They say they developed this vaccine completely independently of the government, and President Trump's role in this has merely been ordering millions of doses of the vaccine. President Trump described that yesterday as a misrepresentation by Pfizer. Why on earth that spat is happening at the moment is very unclear to everyone, but the president suggests the vulnerable, frontline workers and the elderly will be able to get their first dose of vaccine this side of the new year, whereas the general population, because of the huge complexities involved in manufacturing, refrigerating and distributing this vaccine, even if the US military, as we expect, is going to be involved, it's not going to be available to the vast majority of Americans until April at the earliest. So we're now in this curious period. President Trump's lost the election. Joe Biden is waiting to take over. Joe Biden is urging the Trump administration to recognize the scale of the problem. President Trump again yesterday insisted, in the face of all the facts, that numbers are falling when in fact they are rising.
Simon Marks will leave it there, our US correspondent, joining us now to give us insight in terms of what is happening in the United States on COVID-19.